Sacramento with one of these local hospitals are at this point seeing. Karma.
At this point, they are saying that there are some things that families should be concerned about. So they're asking families to pay close attention, particularly if they have young children under a kindergarten age. And they say this is such a concern because when we're talking about hospitals like Sutter behind me, like UC Davis, like Kaiser, like Mercy San Juan, they do have a capacity to treat acute cases, but just simply not as much as they have for adults.
Tuesday, pediatricians from 4 medical centers in the Sacramento region came together, not quite sounding the alarm, but certainly sounding an alert.
This is probably the busiest moment I've ever been a part of.
As all spoke to the rising cases of RSV, that's respiratory syncytial virus, a common childhood illness that has been less common in recent years, likely due to COVID distancing and masking. However, doctors suspect that has also led to lowered RSV immunity, and not just infants getting more seriously ill.
Seeing a bit of a wider range of those children who are being admitted, noticeably the toddlers and the little bit older children.
Though none of the doctors representing UC Davis, Sutter, Kaiser Roseville, and Mercy San Juan could give exact numbers, all said they've seen noticeable and in some cases concerning rises in kids hospitalized due to complications with RSVP, often manifesting as bronchitis, pneumonia, and asthma complications. Dr. Craig Swanson with the Sutter Medical Center for Children says just yesterday his hospital launched an incident command center to manage space and care for seriously ill children.
We're really challenged on the high-level acute care on account of what everyone's discussing in terms of pediatric intensive care beds.
Though Orange County in Southern California has declared a state of emergency, overall, California's pediatric RSV infections are not as overwhelming as they are in some other states, reporting pediatric health centers at or near capacity. However, it's difficult to immediately know how bad Sacramento County's infection rate is, because unlike COVID-19, RSV and flu cases are only reported to the Department of Public Health in the case of death or hospitalization. Doctors on today's call urge parents to be vigilant.
Blue-tinged skin, which is especially noticeable around the lips, any severe coughing episodes, or severe sucking in at the base of the throat.
Not just listening for, but physically searching for symptoms.
I often will encourage parents to take off the clothes of the child to really take a look at how your child is breathing. It's much easier to see if the ribs are, if the child is working a lot harder at the ribs or using their abdominal muscles to breathe.
And so when it comes to addressing the issues of RSV, besides making sure you're doing the proper hygiene, the hand washing, all the things that we've learned, particularly over the last 2 years of the pandemic, they also urge parents to do everything they can and say why they cannot vaccinate their children for RSV. There are flu vaccines, COVID-19 vaccines, and they say if you're getting those flu vaccines and COVID-19 vaccines, you're lessening the chance that you might have co-infections, infections with all 3 diseases, and those are what can get particularly dangerous. So they're asking families to take whatever precautions they are able to. Reporting from Sacramento, Karma Dickerson, Fox 40 News.